What if your heart was asking for help, but it wasn't shouting? Most people think heart problems begin with crushing chest pain and collapse. But in reality, the heart often sends subtle warning signals weeks, months, or even years before a major event. These quiet symptoms are why we call it the whispering heart. In today's video, you'll discover 10 silent warning signs of cardiac distress, why they happen, and when it's time to seek medical attention. Let's begin. Section 1. Why heart problems can be silent. Your heart works around the clock, pumping blood to every organ in your body. When it begins to struggle, the warning signs aren't always dramatic. Instead, your body may compensate for weeks or months. During that time, symptoms can be mild, intermittent, or easy to dismiss as stress, aging, or poor sleep. That's why paying attention to these early changes is so important. Sign number 1. Unusual fatigue. Feeling tired after a long day is normal. But if you suddenly become exhausted after simple activities like climbing stairs, walking short distances, or doing household chores, your heart may not be pumping blood efficiently. Persistent, unexplained fatigue deserves medical evaluation, especially if it's new. Sign number 2. Shortness of breath. Do you become breathless more easily than before? Difficulty catching your breath during normal activities, or even while lying down, can sometimes indicate that the heart isn't pumping effectively. This symptom should never be ignored, particularly if it develops suddenly or worsens over time. Sign number 3. Chest discomfort. Heart-related chest symptoms don't always feel like severe pain. Some people describe pressure, tightness, burning, heaviness, fullness. The discomfort may come and go or appear during physical activity or emotional stress. A healthcare professional should assess any persistent or recurring chest discomfort. Sign number 5. Swollen feet or ankles. If your heart struggles to pump efficiently, fluid can build up in the body. You may notice swollen ankles, puffy feet, tight shoes, swelling that gets worse later in the day. This may be a sign that your heart needs evaluation. Sign number 6. Heart palpitations. Does your heart sometimes race, flutter, skip beats, or pound unexpectedly? Occasional palpitations can be harmless, but frequent or persistent episodes, especially if accompanied by dizziness, chest discomfort, or shortness of breath, should be checked by a healthcare provider. Sign number 7. Dizziness or fainting. When your heart can't deliver enough blood to the brain, you may experience lightheadedness, dizziness, feeling faint, actual fainting. These symptoms can have many causes, but heart rhythm problems are one possibility and should be evaluated. Sign number 8. Cold sweats or nausea. Some people experiencing cardiac distress develop sudden cold sweating, nausea, vomiting, a feeling that something is seriously wrong. These symptoms can occur with a heart attack, especially in women, older adults, and people with diabetes. Sign number 9. Trouble sleeping flat. Do you need extra pillows to sleep comfortably? Waking up at night feeling short of breath or needing to sit upright to breathe can sometimes occur when fluid builds up due to heart failure. This symptom should not be ignored. Sign number 10. Reduced exercise tolerance. One of the earliest signs of heart disease is simply not being able to do what you used to. If everyday activities suddenly become difficult, your heart may be sending an early warning. Don't assume it's just getting older. Who is most at risk? You may have a higher risk of heart disease if you have high blood pressure, diabetes, high cholesterol, obesity, smoking history, a family history of heart disease, a sedentary lifestyle, chronic stress. When to seek immediate help. Call your local emergency services immediately if you experience severe or persistent chest pain spreading to your arm, jaw, neck, or back, shortness of breath with chest discomfort, sudden fainting, cold sweats with chest pressure, symptoms that last more than a few minutes or keep returning. Prompt treatment can save heart muscle and lives. Your heart doesn't always shout. Sometimes it whispers. The key is learning to recognize those whispers before they become a crisis. If this video helped you better understand the early signs of cardiac distress, please like, subscribe, and share it with someone you care about. Remember, this video is for educational purposes and isn't a substitute for medical advice. If you're concerned about your symptoms, contact a qualified healthcare professional. Thank you for watching, and we'll see you in the next video.